delegates, welcome to our e-learning course titled ECG Basics, Neonatal and Paediatric. I am Dr. Venu Gopalan, the course director, and I have with me here Dr. Pramesh Patel, the course organizer.
This e-learning course consists of 8 chapters. Each chapter has 2 portions, a presentation lasting approximately 20 minutes, followed by a revision quiz that has 3 to 5 questions on the relevant topic.
I would like to present a couple of sessions which would help you to understand the basics and help you to follow the rest of the sessions easily. These stickers have within them the electrodes which pick up the electric current. Even though we call this a 12-lead ECG, there are only 10 stickers to place. 4 of these are limb stickers: right arm, left leg, and right leg. Let us look at the various intervals which we calculate on the ECG.
Welcome to the session on rate and rhythm. The normal rhythm is also called as sinus rhythm. And to establish that we have sinus rhythm, every P wave should be followed by a QRS complex. Every P wave should be followed by a QRS complex. And also every QRS complex should have a preceding P wave before it. And P wave should be positive or upright in lead 1 and AVF.
Hi, welcome to this session on PR interval and heart blocks. So what does second degree heart block mean? The second degree heart block means that there is an intermittent drop of QRS complexes. So in other words, the P wave in some of the complexes is not followed by the QRS complex, which means that there are more P waves as compared to the QRS complexes in the ECG.
Hi, I'm Dr. Anna McCorkdale. I'm a consultant paediatrician at the Princess Alexandra Hospital in Harlow in the UK. I'm here to talk to you today about the QRS axis and how we calculate it. I will go through different mechanisms of calculating axis now. Here we have our first axis calculation method, the quadrant method. It's also convention to use lead 1 and AVF to calculate axis. So we will do this using the quadrant method now. First of all, look at lead 1. We have to decide
Good afternoon, ladies and gentlemen. My name is Michaela Pentony, and I'm a consultant pediatrician with expertise in cardiology. I'm currently working in Cork University Hospital in Ireland, and it's a great pleasure to be here today to talk to you about the QRS and ventricular hypertrophy. When we look at the ECG, we have to remember a few things specific to pediatrics. So children chest walls are anatomically thinner, and therefore the voltages on ECGs can be exaggerated. It's really important that the automatic printout or readout of an ECG is not depended on. We need to look at the ECG ourselves because it's frequently not accurate in children. And also, finally, we want to remember that ventricular hypertrophy on ECG is just an aid to diagnosis. We do have to look at echocardiography to help us if there's any concern for ventricular hypertrophy. So I'd love to talk to you a little bit about the QRS complex. So as we know, the QRS complex represents the electrical activity associated with ventricular depolarization in the heart. The Q wave is the first negative deflection.
Hello everyone, my name is Dr. Brian McCrossan. I'm a consultant pediatric cardiologist, and this session is on QT interval, and we will focus on the basics. This is a very practical thing which you should get used to doing. So just remember, the QT interval is the start of the Q wave to the end of the T wave. So how do we measure the end of the T wave? Well, the first thing we do is that we find the steepest part of the T wave and we draw a tangent through there, right the way down to the isoelectric line of the electrical activity in the heart.
Hello, everyone. Welcome to this session focusing on the unique features of the neonatal ECG. I am Dr. Sankara Narayanan, consultant neonatologist at Watford General Hospital. I'm also a pediatrician with expertise in cardiology. Let's discuss the progression of R wave across the chest leads in a newborn. This ECG is from a day-old baby. Right ventricular dominance is the norm in the newborn, giving rise to a right
There is a final assessment that consists of 30 questions. You must achieve a score of at least 80% to pass this course and obtain your certificate.